So we're gonna, okay, so we will go ahead and get started. Let me just, okay. So this is Janine Johnson, chairperson for the Employee Insurance Trust. Today is February 16th, 2021. This meeting is conducted under Governor Lee's Executive Order number 71, issued on December 27th, 2020, set to expire February 27th, 2021. Given the states of emergency that have been issued by the federal, state, and local government due to the COVID-19 pandemic, the trust determines that this meeting is meeting electronically is necessary to protect the health, safety, and welfare of its members, as well as the citizens of Clarksville-Montgomery County, Tennessee. As a reminder, all votes will be done by roll call. Please answer yes or no by each trust member, and voice votes together is not acceptable, nor is showing of hands. An audio video recording is currently occurring, and it will be posted to the website, I hope by Friday, February 19th. That will depend on the availability of our technology folks, but I do think that they're able to do that from home. So I'm going to go ahead and complete a roll call to confirm that we do have a quorum. Marcia Demarest.
Present.
Mark Banasak.
Here.
Amanda Beck. Tommy Butler.
Here.
Charlie Hall. I did not hear you, Charlie, but I'm pretty sure I let you in. Are you on mute? Does anyone see her? I thought I'd let her in. There she is. Charlie, we cannot hear you. I do see your name here, but we are unable to hear you. Leslie Helmig? Here. Thank you. Oh, Charlie, can we hear? I can see you. Can you take yourself off of mute? Can we hear you? Oh, we're unable to hear you. Okay. Tony? Donna? Let's be on mute.
Yes, I'm here.
Okay, thank you. Jeff Taylor?
Here.
Thank you.
And I think John Smith is trying to get on.
Okay. Don't think I have anybody waiting to get in right now. Kimberly Yarborough?
Here.
Kelly Jackson?
Here.
Okay, John? So I don't have anybody in my waiting room. Charlie's coming back on. It was not John. Okay. Ed Long?
I'm here.
Thank you. Michael Johnson?
Here.
Hi. Here. Mary Thomas?
Here.
And Alyssa Pierce?
I'm here.
Thank you. Right, so we will go ahead and get started. Do we have, I think Christine is on, right? Yeah, there she is. I see Christine Johnston from Epiphany. They are our administrators for our pharmaceutical. And if you'll remember at our last trust meeting, Blue presented information to us regarding options they had for specialty. And now we're going to have Christine provide some information from Epiphany. And before we start, I do have to say I was excited. I don't know how many of you looked at the Sunday news in the sports section. There's a whole section about the voice of the Predators. Paul, any of you guys notice that? That's Paul works for Epiphany. So I was pretty excited when that was in there. I'm like, and Melissa or Donna and Amy, I saved the article for you guys. So we'll go ahead, and Christine, we welcome you, and I'm going to go ahead and want to allow you to
Share my screen.
Sorry, it's not letting me. There we go. Sorry about that. There we go. You should be able to share now.
Okay, fantastic. Yes, Paul is our head of our member services. So sometimes if you guys call in, you might be able to speak to him, but he is just as passionate about member services as he is about the Predators. So we're very lucky to have him. So I just wanted to do a quick presentation on kind of where we are with the what we call the medical carve-out program. But this is where we manage drugs that are typically covered under the medical benefit, and we employ similar strategies as we do under the pharmacy benefit. So this initiative started with Tommy and Charla putting their heads together and trying to see if there's a way we could take advantage and provide some savings by utilizing the on-site clinic. And were there drugs that we could offer through the on-site clinic but save the plan some money? So we first started with Sandostatin. We started that, I think, September or October of 2019. We had one patient. It was really life-altering for him to get his medication at the on-site clinic. We then have an additional patient getting their medication there. And then in August, we expanded the program to additional drugs here. And as you can see, most of the savings that you're seeing here is just from August when we implemented the program. And so since then, we've saved about $214,000. And that's a combination of both acquiring the drug cheaper and having it sent to the on-site clinic and having them administering it, as well as taking advantage of the copay assistance program. So when we do that, we are reducing not only the plan's cost, but also the members' cost. So one of the questions was, Blue Cross has a program. How does your program compare to their program? And then also, you know, would there be some limitations if we were to adopt the Blue Cross program? And so here I just did a quick comparison, and keep in mind, I don't work for Blue Cross, so I am just looking at it from what I know, and so there might be more components to the program that I'm not aware of. But from what I can tell, Blue Cross's program is essentially putting a fee schedule on these drugs at specialties. So what currently happens is doctors can buy the medications and then build a medical plan, essentially whatever they negotiate with Blue Cross. Blue Cross is saying, we're not going to let you bill us whatever anymore. We're going to have a fee schedule and you're going to be required to adhere to that fee schedule. The alternative is if they don't want to adhere to that fee schedule, they have to purchase the drug through the specialty pharmacy, the Blue Cross specialty pharmacy. I think that program did offer quite a bit of savings for the plan, but we also wanted to have an opportunity, because of the work that we've already been doing with you all with the on-site clinic, wanted to see what other opportunity there might be. So what our program would be is a little bit different. We do have price controls like Blue Cross does, but what we really want to do is optimize the usage of the on-site clinic and make the member experience better. And so what we really believe in is having the patient acquire the medication at the lowest costing up high quality location. We really strongly believe in local care. A lot of these members are going down to Nashville for their care, and if there's a way we can keep it either at the on-site clinic, have them receive their medication at home infusion, which could often be in the evenings when they don't have to take time off work, or taking advantage of a local home infusion suite within Clarksville. So that's what we would do with these medications primarily. If a doctor does still want to administer the medication, we can still offer that to the doctor if they'd like, but again, they would have to adhere to our discounts that we have. The other thing that we do that we think is quite different than the Blue Cross program is that we have strict clinical criteria on these medications. So we look to make sure that that drug is the appropriate drug for that patient and that it's being dosed appropriately. So we put the same rigor that we do on the pharmacy side of the specialty medications on the medical side. And actually we have a good set of pharmacists that this is all they do every day, is looking at how medical drugs should be covered. In addition, we are able to leverage copay assistance. That's one of the areas where we've taken significant savings for the Remicade particularly. And then the other thing is, if there are manufacturer rebates available, because we are a pass-through PBM, if we do collect any of those rebates, which some of the drugs do have rebates, they're not quite the same amount as what we see on the pharmacy side, but when they are available, we would pass those through to you all. So The next slide is just talking about the opportunity. So we took a look at your claims from June through November. So this is not an annualized amount. This is just looking at that subset of the claims, which is the most recent medical claim set that we have. I have taken out the patients that we have already moved over to the on-site clinic. So these are additional savings already on top of what we've taken advantage of. So we're looking at, just over $1 million for this time period. So annualized, just over $2 million of savings. Most of that savings, is really taking advantage of the copay assistance programs, but also acquiring the drug cheaper and having it supplied to the member either at the on-site clinic or at home infusion. Some of these drugs also, I just want to note, are cancer treatments. We might need to work closely with Blue Cross to have them help us manage those patients, because sometimes the oncology specialists they still want to administer the medication. So that's just kind of a high level overview of our program. I know that Charla is eager to take on new patients, so I don't know if you have anything else to add, Charla. I hate to put you on the spot on this.
No, that's fine. I was going to say, yes, we are looking to assist any way that we can at the clinic by even more additional savings. So I know that we're going to collaborate, yourself and me, and I was going to bring in a couple of our providers and see which ones we can administer at the clinic for even more savings. So I'm excited about that.
Mm-hmm. Are there any questions?
Yeah, Christine, this is Tommy. Do you know, out of that 1 million in savings, what percentage of that might be those cancer patients that we would not be able to manage through this program?
There's a handful. Optivo, which is the number 2 one there, we would attempt to work to manage them, but there might be a chance. And then the Keytruda and the Neulasta patient, there's less than 10 people. Not a lot. Those are the primary ones.
And so where you've had other clients, I think I know you have one that's done the medical carve-out. Have the patients on those drugs or any of these drugs had any major disruption in care?
No, so what we've done is just asked Blue Cross to enter an exception to allow the member to continue to receive the medication where they have been receiving it, and then they would not have any disruption. They'd be able to keep their same provider, and then they would, we'd work with the provider to acquire the medication at a lower cost.
Do these savings represent a side of care savings? Maybe I'm missing that, but I know that under Blue Cross there's some side of care limitations. Does this represent that also?
Yes, if you look at the new ingredient cost column, which is the 3rd column there, that is the savings for changing the site of care. And then the copay assistance savings is the $632,000. That would be received regardless of where the site of care is. And then we have the rebates, which is the $10,000. We're just getting some rebates on the Remicade. Now, what this doesn't factor in is the clinical management savings. Once we are able to manage the patients, we would take into account, we would then look to see if there's an opportunity to maybe move them to an alternative drug or reduce the amount that they're receiving.
So maybe I was looking at the last column, I went to the bottom of that. So where's the total projected savings? I'm guessing that last one's not it. Isn't it an addition to all of them?
Yeah, so the last column is the total savings about, and that's just for this time period, it's not an annualized savings amount. A lot of these drugs are not necessarily received every single month, so it's hard to annualize that amount. But about $400,000 of that savings is site of care, and another $600,000 is copay assistance.
Thank you.
Chris, could you provide the members just a little bit of a summary as to what type of action we would need to take? Because from what I'm understanding here, we are looking at if we were to do a specialty carve out from Blue Cross Blue Shield, any of the specialty medications that are currently covered under the medical plan, if we were to carve them out, and have Epiphany handle these on our behalf, correct?
That's right. Let me make just a couple quick comments. You know, during the RFP and some of the trust members were involved, some weren't. We clearly determined that clinical management was the key to the whole pharmacy programs, and Epiphany's proven their expert clinical management with little really, and I guess unless Tommy, Donna, Amy, Charla, little to no member of heartburn. The fact that Epiphany's so much more nimble, I think they'll do an excellent job in this area. Basically, what we would need to do is just notify Blue Cross of the fact that Epiphany is going to assume these responsibilities. They would put a block on those medications. Epiphany would start administering the plan. It's my understanding Epiphany could start the administration process. I think a couple key dates would either be July 1st or September 1st. And Christine, if you want to speak to those dates, it would be appreciated.
Yeah, so when we're looking at our capacity and making sure that we can continue to provide the utmost care to your patients, we feel like we would be operationally ready to handle these patients for July 1st. I do know that your plan year resets on 9/1, so you might want to consider that to coincide with that. So those were kind of the 2 dates we were thinking. Now we can continue to also offer the optional program, which we have been offering. So we can, you know, for example, contact the Entyvio patient and ask them if they'd like to go to the clinic. It just wouldn't be mandatory until you would implement the program.
I guess another factor would be, it's our opinion, when you get into these high price medical drugs, is the sooner the better. The other thing I think that like Christine pointed out, is Blue Cross really, based on their provider network, they're not able to steer to sites of care. I think where Epiphany would be much more apropos in that area.
Can I add to that? When we first attempted this with Remicade, we were sort of hesitant even at on-site, thinking, how come we can't make them do this? But Epiphany was absolutely correct in letting it play out, because word of mouth has gone a long way. And that's how we're now at 15 patients, where at first, you know, we really wanted to push it, but we didn't have to. Word of mouth spread about the service and how good it was. And now we have people asking us, can I come to you all to get different infusions? So I think that's the perfect direction to go.
Can I ask Chris and Christine, do you feel that we need to verify with Blue Cross Blue Shield that we can, that they will coordinate on some of these oncology drugs, that they will be able to coordinate that? Is that something that we need to verify with Blue Cross before we move in and make this effective, if the trust did vote on this?
I would definitely recommend that. I do know that they're doing it on another mutual client. And I do think that, you know, if we could maybe, as we go through the implementation of this program, just maybe already coordinate the care of those members before it actually goes live, just to make sure that, you know, it doesn't go live July 1st and then all of a sudden we have a situation on July 2nd. So I do agree. And I think that, you know, we've developed a lot more coordination with Blue Cross as of late. And I think that this would be a good opportunity to continue that.
Chris or Kim, do you have anything else that you feel the members need to be aware of as we discuss this carve-out opportunity with Epiphany?
Well, I guess as we all know, it's a pretty sensitive area. I think we've identified that there are some rebates in the medication on this side of the plan. Blue Cross does retain those rebates as a way to pay for their clinical management, which of course Epiphany is going to pass that back through. So it's kind of a sensitive area, but we think that you know, we can discuss with Blue Cross and come to a amenable plan of action.
There is nothing in our current agreement with them that would prevent us from doing this?
No.
Okay, thank you. Do any of the other members have any questions about this? And if you do, feel free to come off of mute. I'm not gonna, I don't see everyone. I'm sorry.
So Janine, this is Tommy. Do we want a motion contingent upon a conversation with Blue Cross, or are we probably waiting until the next trust meeting for a motion?
I think if someone wanted to do a motion, I definitely think we need to have it be contingent with the conversation with Blue Cross. I don't know how quickly we need to move forward. If we're looking at a 9/1 date, I would imagine we could make a decision at our next trust meeting and have conversation with Blue Cross before then. Christine, is that reasonable?
Yeah, we would need a minimum of 90 days to implement this, to do it right. As Charlotte knows, we need to make sure we communicate with members and coordinate all that. So yeah, as long as we would know, if you're doing a 9/1, if we knew what is that, June 1st, then I think we're fine.
I think if we don't have a motion right now, the next step needs to be us going to Blue Cross and letting them know this is what we're considering. Are there any problems? And then at the next meeting, there could be a motion and a vote, or if we had a motion today, it just does need to be contingent on the conversation with Blue Cross.
Typically, Blue Cross wants 90 days for plan changes also.
If I don't hear a motion, I'm not hearing a motion, then I would say our next step then would be to ask the Fessendens to speak with Blue Cross Blue Shield, let them know we're considering this opportunity, and find out how we want to ensure that we can coordinate some of those specialty oncology specialty drugs before we do move forward. So, does anybody else have any other questions? Okay, well, thank you, Christine, for providing all of this information and all of this really great data. We appreciate that, and we'll look forward to touching base with you in between now and the next meeting. And then at the next meeting, we'll definitely, I would assume someone will want to bring forth a motion then, once we have some more information from Blue Cross.
Great. Thank you for your time. I appreciate it.
Thank you.
Bye.
Bye-bye. Right. Trying to get back to my agenda here, guys. Sorry. Okay. All right. Next item is the review of January 19th, 2021 minutes. And Donna did send those out for everyone to review.
It's Mark Anasak. I move to accept the minutes.
Okay, I have a first. Do I have a second?
Kelly Jackson, I'll second.
Thank you. Any questions? Any comments regarding the minutes? If not, we'll go ahead and vote on the motion to approve the minutes for January 19th. Marcia Demarest,
Yes.
Mark Banasak.
Yes.
I don't think Amanda Beck, have you joined us? So Tommy Butler,
Yes.
Charlie, are you able to come off of mute?
Yeah, can you hear me now?
I can, thank you.
Okay. Okay, I approve them. I'll go with the minutes. Yes.
Okay, Leslie,
Yes.
Donna,
Yes.
Jeff,
Yes.
Kimberly,
Yes.
Kelly.
Yes.
I think John, you've joined us, John Smith.
Yes.
Thank you. Ed Long,
Yes.
Michael,
Yes.
Kay,
Yes.
Mary,
Yes.
Alyssa.
Yes.
Okay. And motion has passed. Our next item, we'll move on to old business. We've got lots of items on our old business. That first one we'll do is an on-site update with Tommy and Charlotte.
Yeah, so we'll do items 1, 2, and 3 all at once. I'll cover the expansion, and Charlotte's going to talk about vaccine. Just a reminder on the expansion, the clinic expansion, I'll call it update. The on-site clinic was approved by the trust to be updated, expanded prior to COVID. The funding to do that was approved, and we had architect design work done. After that design was done, we were ready to move to bid, but the timing of that came right around all of the uncertainty around COVID. So I know I brought it up at the last trust meeting, but after the last trust meeting, we, Janine and myself, and Mr. House, Charla, the mayor, and Kyle, and Alyssa at the county met to talk about the expansion before we brought it back to the trust. We talked about the use of the clinic and discussed that the county commission's resolution, it didn't have a term to it, although the commission just recently approved last year the use of both the existing clinic and the Veterans Services Organization to combine them to make a larger clinic. The mayor did agree. The mayor's going to work towards putting a term into that resolution that would have to go in front of the commission again. So, I mean, we're going to follow up with him in the near future about that, and then we'll get back to the insurance trust on that, and hopefully moving forward with that expansion. And then just one other thing, I know Janine's going to talk about a little bit, another funding source, the Esser Funds. But one of the things that might allow us to do is do some updates to our 5 school system satellite clinics also. So any questions about expansion before Charlotte does vaccine? Go ahead, Charlotte.
Okay, so I thought I'd just share my screen, if that's okay, Janine, and sort of cover all of mine at once. Okay. Can you all see my screen? Okay. Are we all looking at the same thing? I just want, okay, good. All right, so the first piece of information is just about the vaccine event that happened last minute on Sunday. This Sunday, we were notified at about 2:45 or so that the health department had extra doses of vaccine. They had about 126, I think that's what we gave, and put out an all-call through our on-site telephone system. And so when that was deployed, we said first come, first serve, never dreaming we would receive over 300 vehicles. And so we gave those shots. We did do them outside. The health department nurses were inside. The on-site staff members, 6 of us were outside, and my words have been, they rocked it. We gave those doses to staff members, and we noticed that there were definitely some communication issues with our system. System is not as robust as our communications department system is, but we are proud that we gave them, and we know that in the future what we're going to do is ensure that we go through the communications department to get that message out, and we're also going to make sure that we prioritize them. And I've got a little bit of information about that. The list is going to be prioritized due to age, due to location, are they directly serving students, and do the people that are first come, first serve, are those ones with chronic health conditions? We know that's important to do. So we're working on that now. And we've got several options, and that's the screen there about what we plan on doing. Our next steps depend on how many vaccine doses we actually receive from the state and or Joey. I think the health department, Joey Smith, he's offering to give us some vaccines in the future, in the near future. And regardless of whether we get 50 doses or if we get 2,000 doses, we're going to go with making sure that we, again, prioritize those folks. We've planned that if it's a small scale event, we'll have it at our on-site clinic, and we'll try to do it at times that accommodate as many teachers and staff members as possible, probably in the evening or on the weekend. And then option number 1 is if we receive all of our doses. And if we receive all of the doses, then the district will probably go remote for that day. And we have a plan set up to give them at Kenwood High School using lots of folks, not only on site, but we'll get some assistance from our school nurses and leadership team. So that way we can all help each other to get those people in and out the doors as quick as possible. Our focus will be making sure that anybody that wants the dose gets it. if they're a school system employee. And if we have enough, we certainly want to get it to everyone. And then a few questions that might pop up that might be helpful is how are we getting that data? And the data is basically coming to me. I'm ranking everyone and making sure that everyone has optimal, priority to make sure that they are where they need to be. We want everyone to get it. And we would hope to have prior notice. This last situation was definitely something we would call urgent because we basically had that storm coming in. We had 15 minutes lag time basically, and we got as much help as we could possibly get. The issue isn't the help though, the issue is making sure that employees know that it's there. So that's what we want to make sure that we have every time. We're going to over communicate the next time it happens. And we're not going to use that on-site system. Like I said, we're going to go ahead and work with the communications department so that way everyone can get that message. I think that's all I've got about the vaccine.
Hey, Charlotte, this is Mark Banasak. Quick question about the vaccine. A coworker shared a story with me today that News Channel 4 is reporting that starting February 22nd, teachers can start signing up along with anyone over the age of 65 at the regular vaccine clinic. If teachers start doing that, does that start to affect our data and how many doses we've requested? Or if teachers want to go on their own and sign up through the state and get it starting on the 22nd, we want to encourage them to do that.
Sure, that's a great question. I think what we would do is talk with Janine, Mr. House, Tommy, and make sure that we have the right communication that goes out about it. We, of course, we're waiting to get that vaccine. We've been an approved provider of them. So we would want to, of course, try to get it as quick as possible, but we're just we're on hold ourselves. And if that announcement, if Channel 4 is saying that, we are waiting for an official on that too. I think I got a whiff of that earlier today, but we'll communicate just as soon as we can.
Hey, Mark, just to add a little bit more to that, we've expected since the beginning that there would be a good chance that the 1B group would have availability before we ever got any shipments to the school system. So we would not expect any teachers or anybody that's part of 1B, if they can get it quicker, we would not expect them not to. So we'll just have to deal with our numbers as they come in. And I mean, there's a chance we could get a bunch of doses in the next few days, but there's also a chance that teachers may have the opportunity to get it for weeks before we get it. So we would encourage teachers, if that 1B is released, as there is a lot of speculation that's fixing to happen, that we would encourage them to sign up through their own means until we get our own. So very good question.
All right, thank you.
Yeah, that exactly what Tommy said. I mean, if you're able to get on and make an appointment for yourself, go for it. And then, if we eventually get X amount of doses, then, we'll offer those to our employees. And again, I hope everyone realizes, as Charlotte said, literally like about 2:15, 2:30 on Sunday, they got that call, and that those 100 and some vaccines needed to be used by 5 o'clock that afternoon because of the inclement weather. So, and then at the same time, leadership team was also meeting to talk about inclement weather and what we're planning to do at the school. So it was interesting, but I can't thank Charlotte, and Mr. House was out there, and many folks from Charlotte's team, Emily Bowers and Tiffany Hampton. There's a whole group of them that were out there in freezing weather doing those vaccines for probably at least 3 hours. So huge thanks to them on a Sunday afternoon going in to take care of that. And we know that, it happened so quick. And I think, using the on-site communication was the option at the time, but, we definitely would not do that in the future. But, and Tommy, and I'm just going to go back to Tommy has said all along since we started this, that we will probably have times where it will be literally, here's 500 vaccines, here's 100 vaccines, and you have 2 hours to distribute them. And I remember him saying that many months ago, and it's definitely been accurate both times. But hopefully, once they do move into this 1B, it'll be a little bit more organized, and it will allow us to do some more planning. But it is definitely just one of those, in this case, whenever I've heard people that were upset about Sunday, I'm like, we had to look at it as an opportunity. those were 126 vaccines that went into arms of our employees versus being expired. And that's the important thing. So, but, so again, thank you, Charlotte, Tommy, and, for making that happen, because I know it was not easy. But, and there was criticism for those, but I mean, how quickly did they have 300 cars there in 30 minutes?
It was literally, I would say by 4 o'clock, we realized, we've got many more than we would ever dream of. So the police actually got involved and they helped us to turn away cars because we didn't want them waiting for a few hours when we knew we didn't have.
Right. And there were some, I know I myself, I did not get the call till about 4:45, but obviously there were hundreds and hundreds that did get the call because they made it to the health department. So that's the important thing. So again, thank you, Charlotte, for that. Because like I say, I know that was not an easy feat. So anybody have any questions on that?
Hi, Janine. This is John Smith.
Yes.
Tommy and Charlotte, if we have a situation like this again, don't hesitate to give me a call. We can spin up some traffic control to try to help manage that congestion. I went by there Sunday. I work Sunday, so on the way home, I'm thinking, what all these cars here for? But so if we do know that, we can make sure we get people spun up to help manage that traffic getting in and out of Veterans Plaza or wherever you do. If you do them at a school, we'll still do that.
Thank you, John. We actually had an after action meeting this morning to talk about that. And that I think was the very first thing out of Tommy's mouth was we will make sure that we have law enforcement there to assist us with traffic. So thank you. That was, as you know, anytime you do an event like that, then afterwards you talk about what worked and what didn't. And that was definitely something that I know that they were aware of. So it's, everybody wants these vaccines. They're like gold. So hopefully in the next few weeks, we'll definitely see an increase in that. So anybody else have any questions or comments about the vaccine? Okay. The next item we discussed this at our last meeting, was the appeal. We have a Blue Cross Blue Shield denial that's been appealed to us. And we did ask Kim Phelps to provide more information. And I know a Q&A was sent out regarding the situation. And again, thank you, Kim, I know you spent a lot of time answering those questions. So I'll let you go ahead and share more information with the team.
Okay, I appreciate that, Janine. Just want to make 2 observations quickly about the handout. On the 4th question down, the answer to it, there's a typo. You probably figured it out. It says a thigh life instead of lift. We wanted to correct that. Donna had already sent the document out, so that we wanted to make sure we got that corrected. And then on the other item, on the next question, immediately after, when it said, can Blue Cross determine how many claims were denied? Just wanted to let you know that we just got that information today and none were submitted or denied on their commercial book of business. So there was nothing for your group. Probably never got past, pre-authorization. Everything was looked at, but there were none that were denied. I believe that was one of the questions.
Okay.
So I don't know if everybody's hopefully had a chance to read this. If you have any more questions, we'll be glad to try to answer them.
Kim, there was, I think, something that I can't remember if I saw it on the Q&A or if I saw it. Can you explain the process that this employee has gone through, all of the different appeals that she has gone through that have led her to the insurance trust, and if she has any more options beyond the insurance trust? I just wanted to verify that.
Okay. She did go through the first appeal process and was denied. She did have another appeal process available to her through Blue Cross, and she chose to bypass that and go directly to the trust. So as a result of that, she has forfeited, if that's the right word, her right to an appeal. However, her provider, her physician, can submit an appeal on her behalf if that's something she wants to pursue.
So she did not do a second appeal with Blue Cross Blue Shield.
That's correct. She chose.
So she does not have the option to do that, but her provider could do a direct appeal if the insurance trust chooses not to vote on this, or if the insurance trust says, let's wait and let her doctor do the appeal and see what happens, correct?
That's correct.
Okay. I just wanted to make sure that the members knew different options. So basically, and I'm going to summarize this, and Kim, if I've done this incorrect, let me know. But what's before us is the request for these surgeries to be approved. And if we do that, we have to be very careful about just approving for one employee only. So either we approve for this employee, but then we have to look at, do we want to modify our plan? We have to look at the cost of that. We can vote to not accept the request, I guess, to deny the request. And then the other option, which I don't think we discussed last time, would be to ask the employee to have her physician appeal and let doctor to doctor talk and then come back to us. Am I correct, Kim?
That's correct.
Summarized it a little bit better than I just did there. So
You did great.
does anybody have any questions?
Is there figures on the number of teachers that are getting the initial lap band surgery? So we could, like, I know at our school alone, there's 2 teachers that were saying they were getting it this spring.
I mean, we could ask to Blue Cross to give us data on how many employees have had bariatric, the bariatric, or not only employees, but dependents of our plan, how many have had that? I mean, we could ask for that data.
That was my one concern, because if, like I said, 2 teachers at my school just were talking about getting the surgery, and is that going to be kind of the expectation of everyone that has the surgery then, that they're going to need multiple follow-ups, skin surgeries?
Yeah, I think that's a good question. I do believe, am I right, Kim, that this member covered a couple of surgeries related to skin removal? Because, okay, we have just obviously not all of it, but yeah. And I do know that this procedure is, I know that I believe maybe Vanderbilt has a program that's become very popular, and I think it's very successful. Like I mentioned last time, I know several people that have had it done within the last year, but I also know several people that have paid for all the surgeries to have skin removal done themselves, because they know that the plan won't cover that.
This is Mark Banasak.
Yes, Mark.
My concern with this process, and I know we're bound by initially what insurance tells us, is we pay for our members to have the surgery to try to improve their health. However, we don't see it all the way through. And again, this is, in reading the statement, this is the person's opinion, we don't have a medical opinion. If the loose skin and baggy skin is causing mental ailments, as well as yeast infections and other things, it almost seems like we're not seeing the whole thing through, that we're doing part A. And I know at the last meeting, y'all explained that they signed a waiver saying we're only paying for part A. But if this has become, the loose skin and all that, detrimental to their mental health as well as physical health because of infections, it almost seems like the member is only being partly taken care of. And I don't know if the remedy to that is to start paying for all the other, so that we get people to improve. They want to, reduce their obesity and do the other as a preventative measure, so they don't have mental health problems or yeast infections. I don't know what the solution is there, but as I hear this case, it's troubling for me to hear, because we're only paying for part of it, or because we paid for this part, now other ailments, mental and physical, have come up, but the trust is not paying for those. So that's just some comments I wanted to think out loud about.
I think that's good feedback, Mark. I think also we just need to remember that Blue Cross are the ones, their medical physicians are the ones that are determining if it's medically necessary. So I think that's the part that, we as a plan have always depended on Blue Cross to do those pre-authorizations for us for any type of surgery to make sure that it is medically necessary. And that's the part that I get concerned when we veer off in some areas. I mean, it was many years ago, we didn't even cover bariatric, which we started covering that, and I'm glad we have. I know for myself, knowing that this employee could have chose one more appeal option, or that the doctor could be appealing to the Blue Cross Blue Shield doctor. I think that's very compelling. I know myself personally, I would be very curious to see if this employee's doctor feels as strongly as they do about it. I would think that a peer-to-peer appeal would be very beneficial for this employee. But that's one of the other options I think that is out there that I think that our employees should take advantage of, or family members should take advantage of.
I have a question.
I appreciate you clarifying that. Is it possible that instead of taking an action on this, that we table it or set it aside and recommend to the person, have a peer-to-peer, have a medical review with the doctor? So that way, if that is a better information to help us make a truly informed decision, then maybe our course of action is not to vote yes or no, it's to respond and say, for us to make a decision, we need you and your doctor to do this to help us make a more informed decision.
I do think that's an option. And Kim and Chris, can you clarify that would be accurate?
That is correct. That is
That would
correct.
be it. I think that'd be a very prudent next step.
And I don't think we would need a motion at this time. I think since we're not looking at changing the plan in any way, but we are looking at providing guidance to the employee who has requested this appeal. Does anybody have any other questions?
I just want to say, I think I agree with that. In this case, we have, I believe, 2 or 3 doctors who have written letters in support. So I do think it begs the question of why have we not asked them to officially file a medical appeal through Blue Cross? So I guess my only question is, Kim and Chris, can you guys reach out to them and provide that guidance and help them with the process?
Yes.
Great.
Okay, does anybody else have any questions? Donna, is that, I think maybe, did you have a question?
I just want to make sure that the way it goes, that we get information back, like what the doctors decide, because if this happens again, I want to make a good decision. And it's just, I don't think we have enough information.
Right. Yeah, we'll definitely be able to get information. I think that we'll know if they approve or they disapprove. Yeah. Okay. I know, Donna, have you worked with this employee? Have you been communicating with this employee?
No, I haven't been. I know who it is, but I haven't been communicating with them.
I'm sorry, Donna. I meant Donna McIntosh in the back office.
Yes.
Sorry, we've got a couple Donnas on here.
Yes. Yes, I have, and I'll let her know that about the peer-to-peer.
Okay. And then the Fessendens can assist, and we may even be able to get, excuse me, Ebony to, I'm not sure if Ebony could, from Blue Cross Blue Shield, could also assist with that.
Right. Yeah, we'll work on it.
Okay, great. Any other questions on that? All right, I think we will move down to the next new business item. Medical premium projections for September 2021. Chris?
Okay, hey, I want to apologize. You see a black screen. My video camera is on. I don't know what is going on. it worked Sunday and now it doesn't. I really do enjoy seeing everybody's faces though, especially since we're not meeting, physically. I think it's encouraging to see everybody. So I apologize. Hopefully I'll have that worked out next time. Got some good news on the medical premium projections for September of 2021. If you would refer to the February 16th letter to Ms. Johnson regarding the medical plan projections, that should be a handout. Does everybody have that handout, or Janine, do you want to share that screen, or what would be best there? You're on mute, Janine.
Are you guys seeing emails or are you still seeing the agenda?
Just see the agenda.
Okay.
There we go. That's it.
Okay, great. Okay.
Okay, am I able to, anyway, what we want to do is we want to look at Exhibit 1, which would be page 3. Here we go, right there. Yeah. I want you to know that this analysis is consistent with the actuarial methodologies that have been used in the past. And my comments are just going to be a highlight of the correspondence in Janine's letter. Again, you all have a copy of that. But as you'll note, there are a lot of numbers, a lot of items between line item A and line item U. And every one of these factors here are utilized to arrive at the cost adjustments needed for the September 1, 2021 plan year. You'll note that there's 3 columns here, which represent 3 different exposure periods. It's our recommendation that we blend the 12-month first column here and the 18-month exposure periods and arrive at some type of decision on what the trust's pleasure is for a rate adjustment on 9/1/21. We certainly don't recommend decreasing funding levels using the 12-month exposure period here, but we do recommend using the 12-month at almost a -2 and blend that with the increase there in the 18-month exposure period of 2.46. Blending those two, and it would be our recommendation that the trust either consider a 0% change or flat on 9/1 or a +1%. Now, we will mention that a good strategy for a +1% would just be a slight hedge in the event losses are different than what were projected. It could cushion any type of increase needed for the 9/1/22 plan year. So I know I've gone through that very, very quickly, but I guess the good news is here that we feel like that you would be very wise to arrive somewhere between a 0% and a 1% adjustment on 9/1, and Marcia may have some comments that she'd like to weigh in on. I know she's looked at numbers and budgets and so forth, and I don't know whether Jeff would have something he'd like to interject also.
Marcia, did you want to share your screen, or do you want to?
Yes, yeah, if I can share my screen, I'll just go through. So I always like to look at things kind of in a, let's see.
Let's see, I don't see, you're not on there yet.
Right.
There we go. Okay.
You see it? Okay.
Yep.
So I always kind of look at things, I like to look at things from a couple different perspectives, and I did go through the analysis that they sent and compared their numbers with what I had. And so basically I went through and up here, I put in basically this one here for the fiscal year 22 for the revenue factor would be no change. And And then I used a 4.5% as they did as well on their increase in medical expenses. And that's kind of, I mean, it's kind of been up and down, but it's kind of running in that area. And so basically what I did is I just went through and took where we were as of this current period, which I'll be going through the financial statements in a little bit, through January, and just kind of projecting revenue based on, you know, current participation and rates that we are that we have established, and then expenses based on the prior year with a 4.5% increase, and then pulling in things like the prescription rebates. So when I do that, I always go in and I look at kind of where we are in June and where we are in August, because as you know, we usually dip down in August because those are the months that we do not take premium revenue or deductions from the school system employees. So using that and going down to where we would be at in June and August of 22, we would be at a 3.7 months worth of expenses in reserve and a 2.37 worth of months expenses in reserve. So we're looking at like about 13.2 fund balance. And so if you look back where we have been historically up here, we kind of run it, looking at the August rate, we kind of run between 2 and 2.5. And so in my opinion, I mean, that gives me comfort knowing that we have that amount sitting in our fund balance, you know, to cover expenses and to cover anything that's changing, because, you know, of course, we know this year with COVID, we have, you know, have had, you know, a lot of different, you know, changes. And then of course, knowing that we have as well, you know, cost saving features that we've been implementing. So, and then based on that as well, I just kind of to carry through to the next year, just rolling that forward, you know, another year in advance, which of course, the farther you get out, the, you know, less accurate, you know, you are, but it would be basically a 3.5% increase to get to that 2-month mark. So I as well feel comfortable if the trust were to decide not to do an increase this year. Kind of the advantages of doing an increase is kind of to head off, you know, a larger increase in that next year. You know, so if you do a 1% this year, and then you do like a 3% next year instead of a 4%, I mean, is that more, you know, palatable? 1% increase, I think, on a family plan for the employee would be $350, I think, for the annual year. You know, so like I said, so I think that kind of, you know, like I said, obviously it's hard to predict, you know, what is going to happen in the future, but that's, like I said, using about a 4.5% increase in the expenses.
Thank you, Marcia. Does anyone have any questions for Chris or Marcia? So what you're hearing is we could go with a 0% or we could go with a 1%. The 1% being an effort to just keep building up our reserves. And then possibly if we have to have an increase the following year, maybe it would not be as significant of an increase. Benefits of I think we all know the benefits of a 0% increase. I do think we have some, let me go ahead and I have something here I want to share. Hold on one second. I wanted to share.
Let me stop sharing.
I'm sorry. Looking for, let's see. Let's see. Can you all see that? Have you seen the premium history? No.
Not yet.
Not yet. We're seeing your email box.
Oh, okay, that's good. Let's see. Sorry, I've got way too many things open. I was hoping I would have been able to. There it is. Okay, are you seeing it now?
Yes.
Yeah, so this gives you an idea, going way back to 1995, 96. This is I started in 2001, and that's as far back as I was able to locate records. And then we started keeping track, but this just gives you an idea. We've had several years where we've had no increases. This was a very difficult year here where we had a 40% increase. And you'll just see, and then we had a few years where we had premium holidays. And then most recently, we've had a 6%, a 9%, a 2.5, and then this last year we had a 5%. So that gives you an idea with the premium history where we are.
Janine, this is Mark Banaszak. Are we looking
Yes.
to make a motion and a recommendation today?
I do believe we should. They are in the middle of, I know both Marcia and Jeff are in the middle of preparing budgets. So as you can imagine, this is a huge impact for both the county and the school system for our budget preparation. So yes, we do. I would encourage us to consider a motion today for the premium set for September 1st of 2021.
This is Mark Banaszak. I'll make a motion that we do a 1% increase. I'm more in favor of small incremental than no increase, no increase, no increase, 9%. And so I'm comfortable with a 1% increase. And I'll make that motion.
I do have a question. This is probably for Chris and you guys. So I'm just looking at your projection and I just want to make sure this is anticipating a 10% increase in our reinsurance premiums and no increase to administrative costs beyond our usual percentage. Is that right?
What the reinsurance is going to be, and so we've got a conservative estimate. Of course, the reinsurance premiums.
Chris, we can barely hear you.
Okay, can you hear me better now?
Yeah, a little bit. You just sound like you're far away.
Okay, I may have been too far from my screen. Let me get a little closer here. You're correct. The Blue Cross administrative fees are in a rate guarantee. The reinsurance, we just made a 10% adjustment. We have no idea what that will be. But we asked the actuary just to plug in a 10% increase, which really wouldn't be much of a factor regardless. But nonetheless, we asked him to put that in the analysis.
Okay, so that's just kind of a guess for now because we won't really know that number if it's going to change at all until much later, right?
Correct.
Okay, just want to make sure I'm tracking. Thanks.
So we have a motion for a 1% increase on the table.
This is Tommy. I'll make a second to Mark's motion.
Okay, we have a first and a second for a 1% increase effective September 1st, 2021. Do we have any other questions, conversation?
I just would like to say I would agree with that. I feel like with the continued savings that we are hopeful to realize on the pharmacy side, and in light of several years running of relatively noticeable increases, I would just like to say I disagree with increasing this year. I think that particularly in light of how difficult a year it's been for everybody, that unless there's a reason to increase, I don't see a reason to cost our employees more money without an actual need to, just for that money to sit in the trust.
Okay. Any other questions?
Janine, this is Kelly Jackson.
Yes, go ahead, Kelly.
I would agree, just looking at the infusion process alone that we're talking about, that on-site may be able to save us. I think we go with a 0 this year and wait to see what the savings, amount to next year. I agree with Alyssa, just because if you look back over the last 4 years, we've raised it right at 5.6% every year. I think if we don't have to this year, then we should wait till next year.
Okay. Any other comments? Questions?
Yeah, I have to agree with the. Oh.
Go ahead, Donna.
Yeah, I have to agree with 0%. Being as classified did not get their step last July, and then their step increase might be in danger this year. I think if we give them any kind of increase, the classified staff is gonna is going to fight that a little bit. They'll be a little upset.
Any other questions, comments before we take a vote? Jeff, did you have something?
I was pretty much, Kelly said exactly what I was going to say. With everything we're doing is cost saving measures with on-site and with prescriptions. I think it would be a good idea to wait and see what happens with that. I mean, if we're only talking about a 1% increase, I don't think it's going to hurt us to do an additional 1% next year.
All right, we'll go ahead and vote on this motion. So we do have a motion, a first and a second for a 1% increase. So we'll go ahead and vote. Marcia,
I guess I'll say yes.
Mark,
Yes.
Amanda's not here. Tommy,
Yes.
Charlie? I'm not hearing you. Charlie, are you here?
I'm gonna say no.
Okay. Leslie,
Yeah, I'm gonna say no, just with everything that's going on this year.
Donna,
No,
Jeff,
No.
Kimberly,
No.
Kelly,
No.
John,
No.
Ed,
No.
Michael,
No.
Kay,
No.
Mary,
No.
Alyssa?
No.
Okay, so we have an anonymous vote of no, so that motion does not pass. We do need to set a premium amount for September 1st, so I will entertain another motion.
I'd like to make a motion to keep our premium rates flat for the coming year.
Do I
Second.
have, who's second?
Jeff Taylor.
Jeff, okay. Any questions regarding staying at a 0% increase? Any comments? Okay, we'll go ahead and vote. Marcia,
So yes.
Mark,
No.
Amanda, Tommy,
No.
Charlie,
Yes.
Leslie,
Yes.
Donna,
yes,
Jeff,
Yes.
Kimberly,
Yes.
Kelly,
Yes.
John,
Yes.
Ed,
Yes.
Michael,
Yes.
Kay,
Yes.
Mary,
Yes.
Alyssa.
Yes.
Okay, so we are going to have a 0% increase for next year. So we will, that'll be good news. We'll be able to communicate with employees and with retirees, and we will obviously continue to monitor our fund balance very closely. Okay, all right, let's get back to the agenda screen. Let's see if I can, I have really moved all of my items around. Let's see. I'm gonna have to go back and see if I can find it. I apologize. Does somebody have the agenda where they can see it and you could let me know what I need to
Yeah, I'm
do?
showing financial statements are up next.
Thank you. All right. Marcia?
All right, trying to get myself unmuted here. So yes, we have the December and January financial statements that were sent out. So I'll just go over the January. I'll just do it quickly. We're looking at in January, the total fund balance of 19,615,444.48. That was expenses for the January were down somewhat from the month of December. We were at, I'm sorry, I'm trying to pull it up here. We were at 4.4 million in expenses. Revenue, we actually had some of the December premiums that posted in January, so we were at 7.3 million. If I can, so that's all that information is available there on the on the third page of the statement showing the medical revenues and expenses. The last section of the report does show the information by group: school system, county group, county roads, retirees, and COBRA. And if I can try to share my screen one more time, I'll just show the I'll say that, but I was going to show the chart that I had shown the month before, or that I've shown previously. Can everybody see that? Some charts there?
Yes.
Okay, so I've shown this in the past. I just like to kind of show it as a pictorial view of what I've gone over in the financials. So you'll see there on that first chart up here, the darker gray line is our year to date for this year. And so we're following the same trend that we have in the past years with the increase that we should see in January. Of course, we do increase more in this time period because we are taking basically the additional premiums from the school system employees that, being spread out over a 10-month period than a 12-month period. And so that's why you generally see that increase kind of showing in those months. Expenses are following along here with the same, I guess, rate that we've had in the past. So where we usually see that dip in January. And then revenue, again, kind of, following along in the same line, a little bit higher than the year before in 1920, because we of course did have a premium increase last year. And I'd be happy to answer any questions.
Okay. Entertain a motion to accept the financial report presented.
So moved.
And I'm sorry, who was that?
Jeff.
Okay, thank you. Do I have a second? Oh,
This is Kay. I'll say.
I didn't catch that. Who was that?
I think it was two people at once, but I'll second Leslie.
Okay, is that Leslie?
Yes.
Okay, Leslie has seconded. Okay, any questions for Marcia on the financial statements? If not, we'll go ahead and vote, accepting the financial statements. I believe that was December and January's. Is that correct, Marcia?
Yes.
Marcia?
Yes.
Mark?
Yes.
Amanda? I'm sorry, I keep saying her name. She's not here. Tommy?
Yes.
Charlie?
Yes.
Leslie?
Yes.
Donna?
Yes.
Jeff?
Yes.
Kimberly?
Yes.
Kelly?
Yes.
John?
Yes.
Ed?
Yes.
Michael?
Yes.
Kay?
Yes.
Mary?
Yes.
And Alyssa?
Yes.
Okay, thank you. Motion pass. And let's see if I can get back to my agenda. All right, there we go. Okay, experience reports. Chris?
Okay, I'll go through this real quickly. We've got good news again. If you all want to grab a hold of your medical plan experience report, the report format is consistent with the previous reports. And as you'll notice under line item A, third column, that are your budgeted costs, and you go down to line item G, the loss ratios. We'll just kind of concentrate there for now. You can see that the combined loss ratio for January is 81%, which is fantastic. That's a very good January. And then if you'll go out to the line item G, the sixth column, the loss ratio year to date is 95%. I guess the one thing that we want to be cognizant of is the loss ratios do bounce month to month. And you may recall September's was 97%, October's was 106, November's was 84%, December's was 108. So now we've dropped back down to 81. So as we know, that fluctuates up and down, but nonetheless, very good news.
Hey, thank you. Anyone have any questions for Chris regarding our experience reports? Okay, then we will move on to the next item, Esser Funds. I wanted to share this with the trust members. There's, it's called Esser 2.0, and the district will be providing a pretty significant communication once our application for these funds have been approved. But I'm sure you've heard about the federal government, the additional money that's being provided to school systems. We as a district are receiving $26 million. As you can imagine, anytime you receive money from the federal government, there's lots of strings attached and lots of expectations and requirements and reporting. And it was very specific how these funds could be used. So we obviously have to follow those guidelines, and it has to be in relationship to COVID in a lot of different ways, but it did allow for building renovations. So the big chunk of that 26 million will be going to our facilities for things like the HVAC systems, those types of renovations. But we were able to obtain some for the on-site medical clinic. So I wanted to share that with you. We are, one of the options that we could use the money for was for wellness and mental health for employees. So we will be adding an additional social worker. We do have one currently at the on-site clinic, social worker / counselor, who I believe as soon as she has started, she's been very busy. I think Charlotte, can you confirm that I guess she's booked every day?
Yes, ma'am. She's completely booked out, usually for a month out.
So we will have funds for 3 years to pay for an additional provider. So we're excited about that, assuming that our application is approved. And then in addition to that, we're also, we have funds to go towards renovation and upgrades at the satellite clinics. And then we can also use some of these funds towards the renovations for the on-site clinic. So those, I believe the application was being submitted last week, early, or maybe this week. Was it last week, or is it currently being submitted right now, Marcia? I know you've been very involved in that.
Dr. Sikarsky is still working on that. We have actually not submitted it yet to the state.
Okay. So, but those are two of the items that will benefit our employees through the insurance trust. So I just wanted to share that with everyone. So we're very excited about that. And again, for those of you on this meeting that are school system employees, you will see a very big communication once everything's been approved that will specifically explain where all of the funds and how the funds are being spent. So we're really excited about that. Does anybody have any questions? I don't know that I'll be able to answer too many specifics, but I did want to give you that awareness. No? Okay. So
I had something I wanted to make sure I said thank you. I wanted to make sure to say on behalf of all of us, thank you for even considering us at on-site. So just wanted to pass that along, that we're certainly grateful. Thanks again.
Well, it's going to benefit all the employees. So we were excited when we were given the criterion and that one was in there. We were very aware of knowing that we could definitely, our employees can benefit from another provider. So that's a good thing. Let's see, next item, on-site employee salaries. Marcia and I placed this on there. We wanted and I'll let Marcia back me up here. But for those of you that are school system employees, you have seen the communication about the increase in salary for this year. As a reminder, no employees. I know, Donna, you mentioned classified did not get a step or a COLA. That was actually for all employees, certified, classified, and administrators. But the governor did add money into the BEP that was one time for starting January. So we've taken those funds plus some of our own funds and we are doing a one-time increase, and that is for all employees, which will include the on-site employees. So we wanted to make sure everyone, all the trust members were aware of that. Of course, the budget, the amendments have not gone to the Board of Education yet or to the County Commission for final approval, but they will be in there. So we wanted to give you that awareness. Marcia, did you have anything you wanted to add on that?
Yeah, so I was just gonna say, so yeah, so the trust fund actually does not go through the normal budget amendment process, but we did treat the insurance on-site staff the same as we do with all other. The amount, as Janine said, I'm working on those budget amendments and calculating all of the funds, but the amount that would be for the insurance trust would be less than 40,000 total. So that was an adjustment based on calculation of a 2% COLA for half a year and then the step.
Great, thank you. Does anybody have any questions on that? Okay, all right. So Charlotte, if your on-site staff wonder if they will be receiving that increase, they will be. So we, like I say, they are considered employees.
Okay, another thank you. Oh, I was just saying another thank you. Thanks again.
Yeah. Next item is item number 5, Radiology Alliance. I'm not sure how many of you may have received a letter from Blue Cross Blue Shield. We did include a sample letter. It was actually the one that I received, letting us know that they are basically, what's going on is they're in negotiations with the Radiology Alliance provider, and they are housed at Genova. So as Todd Hodge, our account manager with Blue Cross Blue Shield, described this as sometimes it becomes a bit of a it's a serious negotiations, and they go back and forth, and sometimes it's right at the very bitter end before they actually agree. But they did have to notify our members that as of right now, this group has not agreed with Blue Cross Blue Shield, so they could very well be pulling out of the network. He does not think it will come down to that, but they did have to by law notify any members that have used the services. So we have over 1,700 members. I certainly hope that they do come to an agreement, because this would be a significant loss for our employees, but they are working with them, and he does feel confident that they will come with an agreement, but he said it could be right at midnight. He said it could come right down to the bitter end, but right now it does go through I think March 31st. So sorry, just let me check my phone here. Got something coming in, but so I just wanted to make sure that everyone was aware, because some of you may have gotten the letter and some of you may have not. I think it depends on if you use the services there at Genova. But he does, again, he does seem to feel that they will come to an agreement. It just may not be till right before the deadline. Any questions on that? Okay. Let's see, monthly claims payment history and large claims. Let me try to share that with you all. Let's see. I think okay, hopefully you all can see that. Okay, so basically, again, each time we meet, like to go through this, and it gives you an idea of the previous month and year where we were versus where we are right now. So you can look, this goes back to February 2020, and you can see where our claims with medical, and then also our prescription to give us our total, and you can see the fluctuation. And of course, in January, our claims are always much lower, because we all have to start with our deductibles again on January 1st. So the claims always look nice in January. And then they start to build up after that. So it's just a one page there to give you an idea of where we are. Any questions on that? Okay. All right.
Janine, could I mention
Yes.
one thing just real quick?
Yes,
Trust members, you all are to be commended for your continued excellent stewardship of the trust medical plans. You got multiple plans. We all know, we realize that you're in a constant pursuit. You're balancing the members' health needs and with compassion, and at the same time, you're maintaining the financial integrity of the plan. So just a clap to all of you all. And I know it's a lot of hard work, but we certainly are pleased with the plan's performance and the solid financial position you're in.
Thank you, Chris. For those of you that have been on the trust for many years, I know you all appreciate when we have a healthy reserve versus the years where we've struggled with our reserves. So it's definitely a good thing to look at right now. So that does feel good. Next item, let's see, we also have large claims. I did provide copies of those. So I won't go over those now, just giving us, we always want to make sure that we're aware of some of our bigger claims that are coming to fruition. And you can see the amount that the trust is being charged. You can also see the savings that we incur from the network discounts, but just to be aware of that. And let's see, any questions about that? Not hearing any. Okay. Our next item is to schedule our next meeting. And at our next meeting, definitely we're going to want to talk about the carve-out. So we'll want to have verification that Blue Cross can handle the oncology specialty drugs. And as Epiphany had discussed, I'm wondering, do we want to look at an April meeting? Do we think that hopefully there could be the peer-to-peer physician appeal could happen sometime during the month of March for our employee or dependent? And then we could maybe look at an April meeting. I'm trying to think if there's any reason why we can't wait until April. We have our premium set. How about April 13th, which is a Tuesday? Do I have anyone that has concerns on that date?
I just wouldn't be able to make it that day myself. That conflicts with and this has happened a couple times with the Intro to Leadership Academy and the other academies that they have.
Okay. How about the 20th of April?
That's fine with me, but I didn't say that so you'd change it just for me.
Well,
Sorry,
we want to have as many members there as possible. If the 20th works for everyone, I think we can go with the 20th.
Will we be doing it WebEx?
It'll depend on whether or not the governor's executive order is extended.
Okay.
Now it goes through goes through February 27th. So if it's extended, I will definitely do via Zoom. If it's not, it would be in person. We'll make sure that, we are at a place where we can spread out as much as possible. But I don't know if anyone's heard if they expect Governor Lee's executive order to be extended or not.
Yeah, the 20th works better for me because we have budget hearings on the afternoon of the 13th.
Okay, well, let's go with the 20th then. And if the executive order is not extended, then we'll have the meeting in person. If it is extended, we'll continue to do our meetings via Zoom. It seems to work well. Although I will say I do miss seeing everybody, but we've been doing this virtual almost a year now. So, okay. And I think that's it. And again, big appreciation to the Fessendens for all of the information that they provided for this meeting, having the actuarial provide the estimates for our premium and the great guidance that you always provide to us. And, especially this special meds carve-out. This is something that's going to be really interesting. And again, a huge thanks to our on-site clinic for all that they're doing with the vaccines, which I would expect there will be lots of work with the vaccines in the next month or so. So that's pretty exciting. So well, I hope everyone has a great evening, and thank you so much for sharing part of your evening with us. Everyone have a great day. Thank you.
Thank you.